So basically, this is the outline of the whole instruction course. I would be telling about the magnitude of the problem, followed by symptomatology and pathophysiology that would be taken care of by Dr. Prakhyat. What are the current treatment options? I will be elucidating to that. Then Dr. Mukesh would be telling the deficiencies in the present treatment that are available. And ultimately, we have a new modality to treat negative dysphotopsia in the form of ND ring. I will be telling you about that. And Dr. Rupal would be concluding it by telling you how does it impact the clinical practice. So as far as the magnitude of the problem is concerned, around 15 to 20% of uncomplicated pseudophakics, that is those patients in which we have done a wonderful job, they complain of negative dysphotopsia in early post-op period. And up to 3% are severely affected by it and they tend to seek the treatment. If you extrapolate this, it is around 200,000 patients every year in India who are seeking for relief of their negative dysphotopsia. And this is a huge number. The importance, the effect it has in our clinical practices can be ascertained by comparing the two situations. Situation number one, when a patient with cataract walks into our clinic and we advise cataract surgery, we give him the option of the best lens. We are very confident about the procedure and we tell him that it is 99% success. However, after doing everything fine, then the patient comes back and he says that he sees black shadow in the periphery of his vision. And he is greatly bothered about it. He is really perturbed. But the doctor tends to be dismissive. He says, you are able to see 6 by 6. You have no problem. Everything is fine. Then the patient again will say, no, I have a problem. I can't see completely. Then there are possibly two scenarios. One, the doctor is not aware of negative dysphotopsia. Then he would do some placebo treatment like lubricants. Secondly, even if he is able to diagnose the negative dysphotopsia, he will tend to make such comments like it will go by itself, use specs to ameliorate this. And then the patient asks, do you have any definite treatment? And then the doctor is at his wit's end. He cannot really give a confirmatory answer to the patient. So the two situations are so very different. In situation one, before the cataract surgery, doctor is absolutely confident. While in situation two, after post-op, when the patient is complaining of dysphotopsia, the patient tends to avoid the situation or brush it aside. This leads to losing faith in the doctor. Patient is left disheartened and frustrated, and he tends to curse the doctor for leaving him with a problem which he never had. So with this background, I will request Dr. Prakhyat to tell us about the symptomatology with which the patient come to us and what are the common factors which are causing it.